I'm Jagila Minso. I'm a pediatric intensivist at Sanford Children's in Bismarck. This is my blue chair story. My dad had asked when I was, 8 years old, maybe younger, what do you want to be? And I said I wanted to be a cartoonist, and he said no. And then I said I wanted to be a dancer, and he said no. And he's like, you need to pick something that you will actually have a career that's like influential and sustainable from. And he listed a bunch of things, and I thought, oh, being a doctor would be cool, so I had no clue. I was afraid of working with children at first. I thought they are so small and fragile and should not have to suffer in any way whatsoever. And then as you orient to it, you realize kids are super resilient, and they bounce back, and they're forgiving, their bodies are forgiving. I can't stop bad things from happening to kids. Accidents are gonna happen, cancer is gonna happen. But part of my job is, if they have to come to me, how can I make that process better? How can I help them heal in that, if they are meant to heal? One of the things that I think is a hard balance in ICU is taking it home with you. So if you have a really sick kid, or you have a mortality, you lose a kid, it's very human, and it's just our baseline to take it with you. And I think that that's appropriate. I think that every loss should be like a scar on my shoulder. I should remember every child, and I do. But in being able to come back to work the next day and being able to continue serving these kids, the rest of the kids, the rest of the families, I have had to practice that surrender of, I did everything that I could. The looking back and saying, we do this in medicine, we look back and say, could you have done better? Participating in that as a constructive way of growth, not as a damning process, has been important as well. And then grieving when necessary. I think in our training, we're not taught to practice how to grieve. It's about the family, it's about the patient, and it's not really about the grief that you take with you. And I've had to personally and professionally practice grief. It's not something that I was accustomed to doing at all. So I have given myself grace and freedom to cry with families if they give me permission to, and a lot of them do. In fact, for them, it's so important to see that their provider doesn't understand the loss in the same way, but feels it to a certain extent. Cry with my staff, that's something that we've done, is huddle in the hallway and just weep, because it was necessary. And so learning that skill through the help of a certified counselor helped me transition into this person of, it's okay for me to feel sad. This was worth my sadness. This was worth expressing that. And it's something that I always keep at the back of my mind, is like, if you are sad, it's because you're honoring something that's valuable to you. It's okay to do that. My schedule is 24-hour shifts here in Bismarck. And what that affords me is the time off then to recover, but also stretches of time to be able to go to Nigeria and do the outreach that I feel I'm called to do there. So I just got back in March, actually. I got to go after 3 years of not being able to go and teach. And part of what I go and teach is a course called Pediatric Fundamentals of Critical Care Support. And it's geared towards people who are not ICU trained, to be able to recognize what a sick child looks like and stabilize them before they can get them to a tertiary institution, for instance. So it's an opportunity to bring the knowledge that we have here over there and build their programs, but doing the same thing here in Bismarck in a way is linking the two. I'm not a morning person, I'll have to say. So it requires a little bit more oomph to get out of bed, but if I'm being called for a patient, it comes on just like that. There's no question about it. There's no dragging my feet. That calling of, I'm here to do this for you because I've been given the gift of being able to do that. I take it as a gift. I don't know of how many people that have the opportunity to become pediatric ICU doctors, and I don't know of many people that have the opportunity to do it in a place where they can live their calling, they can give back, they can do the low resource thing. It truly is a gift. And so for me, when I ramp up in the morning and I'm able to get going, that's part of what fills my cup, is you are getting to live your life as you envisioned it. Maybe not identically in the way that you thought that you would, but you believe that you're called to do something. You believe that you're getting to do your purpose, and you get to do it here. That is a gift, and I honor that gift by showing up. That's what fills my cup, is that I get to do that.